everybody, it's Casey here with Abigail and Miss Bella, and today we're going to talk about canine pancreatitis. Miss Abigail here is a counter surfer and she loves to get into people food, and people food sometimes can cause pancreatitis. The common signs of pancreatitis are vomiting and diarrhea, and this video talks a little bit about the disease, how to prevent it, and exactly what the treatment is. Enjoy.
Hey Joe, it's great to see you again, and
You too, Dr.
I understand your wife couldn't make it today because normally she's really concerned about Bailey, and you know, I know Casey tells me that you're here because Bailey started throwing up for 3 days, and I guess really poor lack of appetite, correct?
Yes.
He's got those classical clinical signs again, those symptoms of pancreatitis, okay? And on his physical exam, his abdomen's painful. We're doing x-rays right now. That's where he is right now, and this is great because with our in-house blood results I can take a look at the blood. I think it's pancreatitis, but I need to make sure because he does get into garbage and he's a bit of a vacuum cleaner when he goes out in the yard. I want to make sure he didn't swallow anything he shouldn't, because sometimes the pancreatitis is secondary to some foreign object like a stone or some other stick or some, and you guys didn't give him any play toys or chew stuffs recently, anything, pig's ears, anything like that, correct?
Nothing different than
but
what we
your
usually
feeling
do.
is he might have gotten into the garbage again.
Yeah, it's possible, yeah.
All right, well, I don't want to shock you with some of this, but this is more of the same that we saw a few months ago. There's a lot of blue and red on his reports, and I'm just going to explain this to you. I'm going to mark this up, so I know your wife's going to be very nervous about this because he's her baby, and I just want to reassure that everything's going to be okay, but we got to keep him out of the garbage. You know, we absolutely must, because the more times he has this problem, the more likely he is to get it again, and it can get worse and worse, and he's sicker this time than he was last time. So I can't stress how important it is to keep him out of the garbage.
We'll do a better job of that.
Okay, well thanks, I appreciate that. So he's got a little bit of a mild anemia, and that just means his red cell count's a little bit low, okay? Not critically low or anything. It's a non-regenerative anemia. He's not trying to produce more red cells, but I think over time, once we treat the underlying problem, this will return back to normal.
Okay.
So, and all this red and blue here, we've been through this before. These are just typical changes I expect to see on the chemistry of pancreatitis. Calcium's a little bit low. That usually gets tied up with the inflammatory process, so I expect that completely. His liver enzymes, his ALK phos, his GGT. The pancreas is very closely associated to the intestines, the liver, so when it gets inflamed, it tends to drag some of the other organs along for the ride, and we do see some of the changes consistent here with pancreatitis. So this is almost a textbook case again. But I really want to make sure there's not something else going on, okay? And we're going to send some blood out to the lab like we did last time to run that SPEC CPL so we can get a number to monitor treatment, okay? Remember the SNAP CPL just says yes or no. So everything else looks okay. I'm very optimistic here, but the garbage has got to stop. We've got to keep them out of the garbage, okay?
We will.
Any other questions while I'm getting the x-rays? We're going to go over the films once they're developed. We've got our digital system, as you know, so it's very quick. And then you and I will look at the images on my computer screen as soon as they're available, and I anticipate that'll be about 5 minutes or so.
And you'll give me a copy of this for my
I'm going
wife?
to definitely give you a copy of this for your wife. Tell her he's going to be fine. You know, it's a little more severe than it was last time, unfortunately. But I'm very optimistic that we're going to make a full recovery here.
Okay, great.
Okay?
Thank you very much.
Thanks. Good seeing you again.
You too.
Okay.